Hello and welcome back, Chronicle Keepers, to episode 2. Today's key chronicle will be talking about neurodiversity. Today we have Dr. Robert Wilfhart here with us, and he runs an ADHD clinic at Mayo Clinic. Dr. Wilfhart, would you mind just introducing yourself and telling us a little bit about the clinic and what you do?
Sure, great. Thanks for having me. I'm a family doctor, so our specialty says we're the specialists who specialize in you, or some people think that we would be the specialists of common illness. And it turns out ADHD is a common illness, right? But it's a condition that, especially in adults, isn't taught consistently to people who become clinicians. I think a generation ago, people thought ADHD was a problem of 7-year-old boys. And it was sort of assumed that when you got older, you'd outgrow it. But it turns out that's silly. A kid who has ADHD turns out to be an adult who has ADHD. And yet that wasn't really carried forward into medical education. So I've been a family doctor for more than 20 years now, and I have seen my peers have inconsistent success identifying and treating ADHD, and it became important to me that we do better at this, because it's a thing that, if we do well, really helps people. And so I developed an interest in it. And more recently, the good folks here at Mayo have allowed me to kind of advertise amongst Olmsted County's primary care providers, so that if they're having difficulty either making an ADHD assessment in an adult or working through problems in treatment, I can be a resource for them.
That's wonderful. So you can diagnose ADHD in primary care? Is that something? It's just a question that popped in my head.
Yeah, I think that's where
Wow.
it actually lives.
That's awesome. Yeah, I always thought you had to go to like a psychiatrist and all the fancy stuff.
It's kind of unexpectedly a diagnosis that doesn't have a designated home.
Nice.
Yeah.
And I think it's quite reasonable to assume that it belongs to psychiatry, because it is a neuropsychiatric problem, sort of. But it's also considered a developmental disorder.
I see.
And so it could live in pediatric development, but again, we're talking about adults, so that doesn't make sense. And some people think neurologists own it. And so then if you think that this is a condition that has feet in all of those specialties, then what that means is it belongs in primary care. Because I think if you've got a relationship with your regular doctor that spans what might be years and years, who better to know you and how a pervasive condition like ADHD affects your life, and to see those impacts and to guide you through a comprehensive treatment program, which can be quite broad. So for instance, because I'm a family doctor, and because a female or a person who has estrogen can suffer variations in their cognition depending on where they're at with estrogen, I can sometimes prescribe estrogen to people who have ADHD to make their ADHD better. But a psychiatrist isn't prescribing estrogen to somebody, right? Because they're the psychiatrists. But I do a bunch of things. And so if you come to me with a complaint of attention, you might leave with ADHD meds, but you also might lead with a CPAP machine or hormones or prescription for an iron supplement. And so that's why I think ADHD should live in primary care, because it's got its fingers in everything.
Wonderful. That's awesome. That's a lot of information that I had no idea about. So
Yeah. I'm pretty blown away right now.
yeah, I know. I'm like, what?
Right. We're just starting.
So we don't want to forget about Tina Streiff, who's
Yeah.
also here with us, who's from the subcommittee or subgroup of neurodiversity. Thanks for being here.
Yeah.
Thank you.
We'll be talking to her here in a few minutes. I do have a question for you, Dr. Wilfhart. Have you noticed in your adult patients, or what barriers have you noticed that ADHD people or individuals have when it comes not only to like their work, but also in school? Like, what accommodations have you helped people with?
What barriers does a person who has ADHD have at being successful at school?
Yes, thank you for reframing my question.
Yeah.
That works.
So I should be clear that because I'm a family doctor, I not infrequently see kids who have ADHD, but this program that I'm working on is for adults. And so many of those adults are out of school, not all of them, but some.
Mm-hmm.
Asking about accommodations is a good segue to what Tina, I think, will be talking about in a little bit.
Oh, yeah.
Because I believe the interests of the employee support group for neurodiversity would include making the world a more hospitable place for people who have ADHD, amongst other problems, which is not my job.
Yeah.
Right?
Correct.
My job is to throttle it.
Yeah.
And so my preference in treating ADHD would be to use a combination of behaviors and medicines to make it so that they weren't symptomatic at all, and that the processes that were constructed for people who don't have ADHD seem to work better for them. That would be my preference, to be honest. But I understand that that's not the world that I live in.
Mm-hmm.
And it can be hard to find a perfect combination of meds and behavioral strategies
Yes.
to keep a person successful. And so accommodations are part of it. Commonly, people who have ADHD have difficulty estimating how long a thing is going to take. You know, they sort of live in the present. And it can be hard for a person who has ADHD to kind of imagine what they're going to be like in 30 minutes, much less 3 years from now. And so one of the more important accommodations has to do with asking professors or educators to be more considerate about how time is used. So a common accommodation, for instance, would be like if a person would normally have 2 hours to take a test, maybe I say, hey, 2 hours is fine, but it should be in 30-minute chunks. 30 minutes, a 5-minute break, 30 minutes, a 5-minute break, 30 minutes, like that, which would be my preference, because the whole thing with ADHD is it's hard to concentrate for long periods. But that accommodation tends to be hard for many in the educational system. So a more common way to write it would be to say, well, they just get time and a half for testing.
Oh.
And the idea there is that the person who has ADHD might be actually concentrating on their test for 30 minutes and then spend 10 minutes daydreaming and then be able to come back to it, but not have that little mental vacation kind of bite them. There are other accommodations that are common and important. There's a bunch of circumstances where a lecturer might be okay with having their lecture like recorded. And it's reasonable for you to not only get like a verbal instruction about an assignment, but it written out so you can reflect back on it later. These are things that I think a good manager would do in like any circumstance.
I agree wholeheartedly. As someone who was diagnosed with ADHD just last year, I'm 38 years old. As I'm settling into this diagnosis and as I'm learning to work with my brain rather than fighting desperately against my brain to fit into a mold of society that just doesn't work for me, I am finding I am completely time blind. I don't know when things happen. I have a terrible time remembering long ago or even like last week what I did. And part of the diagnosis process, and I did get diagnosed by my psychiatrist because so many of the questions to formally diagnose ADHD focus on how were you as a child? You know, how did you sit through classes? And I was like, I can't remember last week. How do you expect me to remember what I was like in third grade?
Right.
So she walked me through and sat and said, okay, maybe think of this question this way and give me a different answer. It actually took longer than I thought it would to get that diagnosis because so many of the questions that she was required to ask me just didn't fit with my lived experience as a person with ADHD, especially as a woman with ADHD. So it's been a really interesting experience finding out you're disabled at 37 years old because I have a disability. That in itself has been something I needed to take time and learn to love about myself. I've had to have uncomfortable conversations with everyone in my life about I do need those breaks. You know, I do need the time to process what I'm hearing because I don't always do it in the moment. I need to like take a step back and think about what I need to say next. And with ADHD, that feeling of I'm always looking towards the next thing. There's like a adrenaline, it feels like almost in my body to go, 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 go. I'm in a lot of skills training on how to calm that down, how to be present, how to, like what coping skills work for me. Do I need to fidget? Do I need to color in order to focus? For me, I need to watch TV while I work. That's an accommodation for me. I literally have something I've seen a million times on because it takes away part of my brain and lets me focus in the rest of my brain on what I'm working on. But if I was working on site, I would have to do that like under the table. I'd have to hide my little, and it's just an accommodation. I'm not even paying attention to it, but it gives me something to do my work and finish with. So it's been quite the experience.
Yeah. So I kind of wish, Dr. Wilfhart, you're my primary care provider growing up, because I needed that test accommodation thing going on. I have ADHD myself, and I didn't get that till I was in college, and it's pretty hard not having it. That squirrel kind of thing where you see it. Yeah, I get distracted by squirrels, yes. There are actually many different kinds of squirrels, but we won't get into that. We won't get into that. But,
you know, just talking about accommodations, like seeing the world through a person who's neurodiverse or has ADHD specifically. We talked about school, but like at work, what do you think would be the most common types of accommodations a person would have in like an office job?
We actually our Neurodiversity Subcommittee just hosted someone from HR to talk about the accommodations process, the difference between an accommodation request and FMLA. The most common accommodation requests for people with ADHD are verbal and written instructions being handed out, more time to complete projects, breaks, like being able to step away from work for 20 minutes, which you would think is federal law, so we have to. But as a salaried employee, I'm often in back-to-back meetings all day. I don't get a break. Even over lunch, I have to fight for that lunch hour because there's so much expected of me. So having time away is exactly accommodation. What a lot of people don't know about ADHD too is there's a lot of sensory stuff. ADHD, autism, BPD, it's all in this frontal lobe of your brain, right? And a lot of the symptoms overlap.
Yes.
So I, for a long time, thought that I was autistic. And my therapist was like, no, you just have ADHD and you have sensory sensitivity. So like if I had to sit in these lights all day, I would lose my mind.
Right, yeah.
So another accommodation is a hat. I used to wear a hat when I worked on site, or sunglasses to do my work, to dim the light around me. Now I work in a little cave in my basement, and that works pretty well. Other really common accommodations is coaching, mentoring. Give me a mentor, someone who I can talk to about parts of working that I just don't get. Like tactful speaking, lack of the impulsivity that comes with ADHD can sometimes make a person look rude or look a certain way. So having to be coached and talked through with that. My boss and I have a great system. I trust him implicitly. So when I go too long or when I get too intense about a subject in a meeting, he'll actually send me a little GIF, a little GIF,
so nice.
just on the side, because he knows I don't intend to. I don't.
Right.
I never mean, sometimes I mean it. Most of the time I don't mean to get that intense about a subject. I just can't always stop it, for lack of a better phrase, without someone kind of interrupting me in the middle and saying, hey, you're getting too deep in this, let's move on.
Yeah.
Those are the accommodations I see.
So Tina, you mentioned like certain mental health disorders or other diagnoses kind of overlapping each other, and this kind of makes me question Dr. Wilfhart. What have you noticed in combination with ADHD people? I myself have anxiety and ADHD. Are those two common, or are there other common ones that you've noticed?
Comorbidities.
Yeah, comorbidities.
Yeah, it's much more common to have comorbidities than not. I think the statistic is that only about 5% of people only have ADHD without there being something else.
Wow.
And so as I heard Tina describe her symptoms, that include the sensitivity to instance for the bright fluorescent lights. The sensitivity to lights wouldn't be considered a symptom of ADHD, but we could consider it a distraction, right? But we wouldn't see light sensitivity on the checklist of making a diagnosis. I think that when a clinician is meeting someone who has a complaint regarding their attention, it makes sense for that clinician to consider ADHD, but also to do their best to consider all the things that feed into distractibility. Because I think the statistic is 55% of people who have ADHD are also anxious, and about 45% are depressed, and about 15 to 20% have a learning disorder. I see a ton of people who have binge eating or had been anorectic because those complaints sort of overlap genetically with ADHD. Tic disorders overlap significantly with ADHD, and actually if you treat the ADHD better, their motor tics tend to go away.
Wow.
Iron deficiency seems to run with it. There's parts of the planet, Persia specifically, I believe that apparently doesn't have a lot of zinc in the soil, and so zinc deficiencies can kind of reveal your inattentiveness. So there's a slew of comorbidities. And if the only thing we did was treat ADHD, that'd be awesome. But you'd still have all the other junk, right? And so ideally, or I hope, Pedro, that you're getting attention paid to ADHD and anxiety, right? Because that's how you're going to optimize your function.
Yeah, Mayo Clinic's taking care of me.
Awesome.
Very well. I appreciate that.
Yeah. So, but comorbidity is the rule, and that's why I think I write prescriptions for a living, and I like doing it. The prescriptions for ADHD work really great, which is one of the things I like about treating it. Is I got tools that work.
Yeah.
But if the only thing that I did was prescribe those pills, I would not be a great doctor for anybody.
That's
right?
true.
Okay.
That's true.
How do you see the difference in symptoms between men and women with ADHD as adults?
So the symptoms that I will describe as the core symptoms of ADHD, which if anybody's ever Googled it, there are 9 symptoms of inattention and 9 symptoms of hyperactivity or impulsivity that are considered the core symptoms. And that was a checklist that was developed for those 7-year-olds, right? The first graders.
Yep.
Like one of the symptoms is, can you sit in your desk at school, essentially? and so for me to ask that of an adult makes no sense. But one of the reasons those are considered the core symptoms is that all those comorbidities have overlapping and networked effects on a person, right? So if you are, for example, anxious, that will be distracting. And so even though an adult who is asked about how ADHD affects them will tell you that emotional ups and downs, variability in emotional awareness is a big part of what they experience. We don't call that a core symptom of ADHD because that emotional variability, you could also get there from depression or alcohol use or anxiety, right? And so if we talk about the core symptoms, those are going to be reasonably similar between a guy and a gal, a person who is socialized male or who is socialized female. The difference, I guess, would be that we expect more of females than we expect of males. So a dude in the Midwest can be either chill or angry, right? We got those two default settings. And I think men know how to be angry, and so they with some frequency, they just pop off. Right, but we expect a woman to have emotional skills, and so the person who is socialized as a woman is going to feel chill or angry, or vulnerable or frustrated or insulted, and that person might have had a bad experience at work. They underperformed for some reason, and they got a talking to, and they feel bad about it. And so they might internalize that feeling. Are you all familiar with that phrase, internalizing?
Yep.
So you kind of like bury it deep inside, and your whole experience becomes smaller as you pull away from the world. And so a woman is much more likely to be mislabeled as anxious. I think that poorly managed ADHD in a female looks like anxiety. It turns out it takes 3 chemicals working together to access your working memory. Dopamine, which is kind of like the ADHD chemical, is one of them. But iron and estrogen are the other 2. And dudes have a leg up because my estrogen is at a pretty steady spot.
Yeah. Okay.
But a lot of females have varying amounts of estrogen. And so then they have the premenstrual week where they're in an extra thick brain fog, and that's unfair. Or they just gave birth. And some of that postpartum depression might have a little extra flavor. Or they just hit menopause, and now they're a 50-year-old who had been doing okay and then isn't. It's an additional level, I'll say 2 additional levels of difficulty for a female.
So, not to get too into my own business, but I stopped birth control. And birth control replaces the hormones with the hormones in the pill. So I stopped about a year ago. That's when my symptoms started. I was pretty managed for the most part while I was on birth control, and I can't get right now my primary to understand that I'm pretty sure it has to do with my estrogen levels in my cycle. And it's been a battle, and I think that's exactly what Dr. Wilfhart's trying to do, is trying to get to those primary care providers to say, hey, ADHD looks different in people, and we need to expand our knowledge of that. When I tell you it was a shock to get diagnosed with ADHD, I have an advanced degree in a discipline that requires so much concentration. I have no idea how I made it through college, other than with lots and lots of caffeine and nicotine. And nicotine is an interesting one because nicotine treats ADHD. What? And as soon as they take away the addictive part of nicotine, it stops working as much for ADHD. And I just find that fascinating. I love all this new research coming out about my brain and how it works, because the more I know, the more I can start internalizing and finding those different coping skills that will make it.
I'd like to hasten to add to say that nicotine doesn't do a good job.
No, it doesn't. No, I agree.
It
It doesn't do a good job, but it does a job, right? And I'm pretty sure it got me through. But you're absolutely correct.
Yeah. I mean, I feel like getting a diagnosis might even help relieve some anxiety and depression, because you understand yourself a little more and why life has been so difficult, right?
Yeah. But you can't make the people around you understand.
True.
When I think about my workday, and when I think about what I need to accomplish in a day to feel good about my own performance, to be proud of my team, because I'm a lead in IT here at Mayo, and when I think about everything I have to go through to ensure that my working memory, which is total trash, like I can remember things. I have a million notebooks around me at all times. It's not a great system, but it kind of works. But I still have times when I get talking tos. Oh, you're being too impulsive. You're asking too many questions. Are you okay? Are you okay? If I get asked that one more time. Like, I'm fine. I just wish you would meet me where I'm at. I wish you would say, okay, I completely understand that you have something going on. Let me coach you, like my boss. That's why I'm so glad I have my boss, because he's willing to work with me, to coach me and say, okay, Tina, your impulsivity, which is why I talk so much, it has its place. But depending on how far up you want to go at Mayo, what your goals are for your career, you might need to have some skills for tactfully telling someone that what they're doing might not be the smartest, or tactfully coaching another team member. And I really want to kind of pivot this conversation a little bit, because we spend so much time talking about the deficits and what is quote unquote wrong with people with ADHD. And one thing that our subcommittee is really trying to do is celebrate people with different minds. I call it the limitless potential of the human mind, because there are literally no two brains alike. And everyone brings something different and meaningful to the table. When we're in those Neurodiversity Subcommittee meetings and we're looking at our members, we're trying to think of how we can help them. It's empowering to know that we can bring together a community and focus on someone who is autistic versus allistic. That person might have some trouble understanding nuance in conversation. And that's fine. I can coach, or managers can coach someone through understanding that nuance. But let's focus instead on the fact that maybe that autistic person can really gather those little details they love so much and turn it into something great.
Oh, yeah.
Or that autistic person can really empathize with a patient and understand where they're coming from and give them the best level of care that they can.
Yes.
So reframing that is really important to me. I am not my deficits. I am an amalgamation of all of my good and bad.
I see.
That kind of made me think kind of about masking. With ADHD, we have to be very aware of what we're doing, with our bodies, with our tone of voice. Dr. Wilfhart, can you kind of talk a little bit about masking and if there's any detriment to maybe masking or not?
So I'm a little worried that I might not be on the same page with everybody at the table about the importance of masking.
Oh, okay.
Okay.
Because I think everybody masks.
Everybody
that's
masks.
Oh, okay. Yeah.
Right? And there is a really understandable idea that I think, Tina, you just spoke toward, and that is prevalent on some sites on the internet about being open to neurodiversity, celebrating differences. I really want that for people, but that's not the world that I live in.
Yeah.
Mm.
And
Yeah.
so I hope, Tina, that you find a bunch of managers as good as your manager, or make all managers as good as your manager.
Yes.
But I don't think all managers are as good as what you've just described.
I guarantee you they're not.
There's data from Norway. So Norway is about the same population as Minnesota does, and like Minnesota, they have their school districts like grouped into these geographic groupings that I think is meant so that they, can hire one counselor for this region, and just to spread out their utilization of resources. But the way they do it in Norway is this psychologists that would be involved in helping a Norwegian elementary school kid get diagnosed with ADHD are very independent, and so there is variability from geographic distribution to geographic distribution. And it's sort of a natural experiment, because in some areas of Norway, kids are labeled more quickly than in others. And in some areas of Norway, they might be labeled but not get meds. They might instead get psychological help or like organizational skills training. And it turns out what happens in Norway is that if you get labeled without meds, you do worse. Teachers of those kids want to be part of a successful project. They want to have a kid in their room that was struggling, and by golly, we fixed it, right?
Yeah.
Mm-hmm.
But if instead what happens is the psychologist says, oh, little Timmy has ADHD, and they didn't get the meds, because right now it's the meds that are the most obviously successful part of a treatment program. But if little Timmy got the label and his deficits were made more obvious to the people around him because he got labeled, but then if little Timmy didn't get the treatment program, the people will recognize his deficits without thinking he's part of a successful project, and they will judge him more harshly. And so my fear is that if a person with ADHD or autism, or just a quirky person, doesn't mask some, they are going to suffer. Everybody
World,
mask.
yeah.
I need you to mask.
Yeah.
The point of your supervisor, Tina, giving you that good advice about, hey, we need to be tactful in difficult situations, is helping you mask. Because it would be super easier just to say, hey, buddy, you just screwed up, in a way that feels real but can be perceived as unprofessional, right? And so I'm all about masking. And I worry that if people are kind of in a hoorah phase of accepting me for who I am, and I wish I could accept everybody for who I am, and I want to be that neighbor for people. But if I'm your neighbor and I want what's best for you, then I want you to be great at masking.
I agree, actually. I think we should have a society where everyone is unmasked and unable? I think that's a false dream, because I have a mask on right now. Everyone has a mask on right now. It's normal. You're not the same person you are when you leave your house in the morning. I think the nuance there is being able to unmask just a little bit with someone who understands.
Yes.
Our Neurodiversity Subcommittee, the best thing about it, I think, is that all of our officers are willing to have one-on-one conversations with our members, just to check in, see how they're doing. And I recently met with this woman who told me she has never been able to have what looks like a normal conversation between two people with ADHD at work, because she's never met anyone who she's wanted to or felt comfortable enough to have those quick side conversations and then come back to the main point, or to, point out a silly bird outside without even missing a beat and then come back to the conversation. That kind of flow of relationship and of interpersonal skills, I have to hide a lot of that behind that mask as a manager here, or as a lead here, because it's not professional. I'm kind of terrible at it. I think that's why I get all the coaching. But it is just a part of life that you are masking outside. But having those moments of, this is just me. I'm just going to be who exactly I want to be right now. And understand that working with neurodiversity is hard. It's not impossible, but until we have more people who understand neurodiversity at its core and who don't judge and who allow for people to show little bits of who they are and celebrate those little bits, that's when we succeed as an employer. That's when we succeed as a leader in healthcare. And that's what our group is for, is saying, hey, we're not being heard very well. And there are ways we could be heard better. And something as simple as the accommodations process is incredibly complicated. And it is hard to find. It's hard to work through. And when you already have executive functioning issues, trying to find all of the links, make sure you're working through it without someone coaching you can be incredibly overwhelming. Mm-hmm. And it stops people from getting the care they need at work mm-hmm. in order to be their best selves.
Mm-hmm. Yeah.
Yeah, so we need a little bit of compassion and understanding from our peers and leaders, you know, when it comes mm-hmm. to like communication and professionalism. And I think a lot of people don't really understand how much of a struggle it is to really put on that performance and be a nice professional person when you're neurodiverse.
Mm-hmm.
You've spoken to a really lovely vision, and I respect that, mm-hmm. and I want that for us.
Mm-hmm.
I was going to say that I think that the best supervisors are looking for results, and they're flexible about process,
mm-hmm.
right? Because if you have more success at home with your hat on, working in a dark basement, that's great. Like it doesn't hurt me for that to be your preferred working style, mm-hmm. right? As long as we're getting the job done that we had set out for ourselves. I appreciate your words.
Mm-hmm.
Mm-hmm. Well, Pedro, let's talk a little bit about the subcommittee.
Yeah, could you tell us more, Tina, what the mission is and what you're trying to, what your goals are?
I have it here, and I just want to read it because we spent several days working on these words.
Gotcha.
So our mission for the Neurodiversity Subcommittee, which is a subcommittee of the disability merge as of right now. We do have goals of becoming a full-fledged merge, but we didn't want to start out the gate as a merge because we weren't sure what kind of a reception we were going to get or if we would have the membership for it. So our mission is to foster belonging, celebrate unique talents and perspectives, and create a better work life for neurodivergent people at Mayo Clinic. And our vision, how we're going to get there, is we envision a future where neurodivergent individuals thrive at Mayo Clinic, empowered by an inclusive culture that recognizes and appreciates their diverse talents and perspectives. Over the coming years, our subcommittee will spearhead efforts to elevate awareness and understanding of neurodiversity, fostering compassion and respect for individual needs. Through our collective endeavors, we aspire to create a workplace where diversity is not only acknowledged, but actively celebrated, contributing to a more vibrant and harmonious community at Mayo Clinic.
That's absolutely beautiful. I love that.
We're very proud of it. I think the best way for folks to connect with us, and we want to hear from you. Right now, we're very corporate, not patient-facing focused. We don't intend to be. It's just most of us who are the officers are in IT or OIS, in research, in media. Our biggest presence right now is on Viva Engage, which is formerly Yammer, with a group called Neurodivergent. And then from there, you can also see all of our information. That being said, we are a private group on Yammer because we think our members deserve it. And there's still a lot of stigma around having any kind of neurodivergence. Mm-hmm. We have a Microsoft Teams channel, and if you search for neurodiversity, it'll come up. We just want everyone, if you decide to join and participate, please be respectful of everyone's privacy. If someone does diverge, we never require it. We never require diagnoses. A lot of folks are self-diagnosed because the country we live in, it can be hard to find a doctor.
Mm-hmm. And expensive.
And out of reach for a lot of people. So we want everyone to be private but celebratory, and you should see the conversations we have. It's, hey, I need a hack for this thing, or here's something on the internet where you can change all of your brightness down to something you can actually read so people can actually focus in on their work, or notebook celebrating. You know, like, who doesn't love a planner, even if it doesn't get used as intended?
Just sits on like table.
Exactly.
Just for decoration.
Yeah, so we have, I want to shout out our executive sponsor, Dr. Kristen Vickers, who is amazing. And really quickly, we are actually the focus of the November Everybody In conversation, Neurodiversity in the Workplace. So Dr. Vickers will be talking with everybody, and we'll have a moderated conversation at the end about neurodiversity in the workplace.
Wonderful.
So Chronicle Keepers, which is our listeners, if you guys don't know, we do have fidgets. So if you're watching the video version, we're playing around with these fidgets just to pay attention, kind of keep focused. I'm also a member of the subcommittee, and I have attended some of the meetings, specifically one with the accommodations that you spoke about earlier, where they spoke about like environments, accommodation for environments. I think one that's cool, and that you can, and if you're an employee here or if you're a member of the community and you have like a job that needs these modifications, there are some that don't require you to go through the whole process. Like, for example, I spoke to my supervisor, and I have trading card games from like Nostalgix graded by AIAGS that are on my desk, or pictures, or like little fidgets, cubes that help me feel like I'm actually at home when I'm working here, and it helps me focus more. So those are some things that kind of personalize your area. But then there are those other accommodations that you have to go through the whole process to get funded and stuff. So I definitely appreciate what you're doing, both of you guys, helping your community in different ways as well. Dr. Wilfhart, you kind of explained it a little bit. Maybe there's some more to this, but for both of you, what drove you to pursue this path about neurodiversity?
Kind of as Dr. Wilfhart mentioned earlier, neurodiversity encompasses everything from autism, ADHD, learning disabilities, mental health conditions, acquired neurodivergence like PTSD. I've been a social worker and an advocate for people for most of my life. I've worked at women's shelters. I've advocated for folks who don't have enough to learn, to eat, to grow. Ironically, when I started at Mayo, all of that kind of went away because I work in IT. It's a very different environment. I missed that advocacy. I missed speaking up for people who don't have a voice for whatever reason. And I didn't realize I missed it until I got diagnosed and this group's formed. And I just found this whole new purpose to my workday, which is to take a few minutes to talk about wellness. Because at the end of the day, everyone with ADHD, they can focus on symptoms. I choose to focus on wellness. How can I be my best self, my most well self, whether that's at work or at home? The subcommittee actually started because I asked a question. It was right after my diagnosis. We have these all IT meetings. And I asked a question of my IT leadership, how are you prioritizing the wellness of neurodiverse people or something? And Elena Coffey, who is our chair, she reached out, and she was a new employee to Mayo, and she was like, hey, I love this question. Let's try something. And then it kind of just organically grew from there into what it is today. I think it started with Elena and I, and then she kind of pushed it off the diving board and into the water, and off we go.
Well, my route was a little different. So I really love being a family doctor. I really love feeling like you could drop me in a neighborhood and I would help the neighborhood. And I can say that in my specialty in a way that, like, a nephrologist, they do great work, but they're not going to help the people who don't have kidney trouble, right?
Mm-hmm.
Yeah.
And so I feel like I can be a neighborhood doctor, and that is like, it's super important to me.
Mm-hmm.
So one of the things we talk about in medicine is the effect sizes of our treatments. Like, how useful is it for me to prescribe, like, Christina, pretend for a second that you had high cholesterol. And if I prescribed you Lipitor,
Mm-hmm.
which is a lovely medicine,
Mm-hmm.
I might add 6 months to your life,
Mm.
which is nice. That's good work.
Yeah.
I'm happy to
Good
do
job.
that. Right?
Thanks for
6
that.
months.
There's one paper by a famous guy named Russell Barkley that suggested that if I treated ADHD, I add 13 years to life.
What?
Right? And there isn't going to be a thing in primary care that I do that has that sort of impact for people.
Wow.
Now, that 12.7 years of life added hasn't been replicated in other studies, so that's probably the upper limit, but still, that's a big number.
Mm-hmm.
So this is a thing that physicians do badly that could be great. It's also true that people who I love have ADHD, and I watch them get bad medical care, and it pisses me off. And
Yeah.
it makes me want for them more,
Mm-hmm.
right?
Yeah.
Just like I would want for y'all more,
Right.
just in an attempt
Thank you.
to be neighborly, you know?
Appreciate that. Thank
Yeah,
you.
I will say, I wonder if that number is driven by, and I know we're wrapping up, but aren't people with ADHD like 25% more likely to be an addict? Or it's a crazy high statistic, the overlap of ADHD and addiction. Like, imagine if you caught that early in a kid before they were able to search for their dopamine through some kind of a drug.
Yeah.
So that the 12.7 years of healthy life expectancy added, the study specifically was kids who were diagnosed with ADHD in the 1970s and 1980s. I'm guessing those were kids who were pretty severely affected. And then it's a life insurance study. The life insurance companies know if you lived or died, right? And so they just kept track. They found these kids after 30 years and said, who's dead? And that's where the data came from. Many of the deaths are accidental. So one of the ways that I protect the lives of Minnesota's teenagers is by having them take their Ritalin before they get behind the wheel of the car, right?
Oh.
And then there are all sorts of deaths of despair, because addictions are common. I'll say, let's pretend for a second that one of us had a really complicated treatment program for diabetes, and it required you to test your blood sugar 4 times a day and make dose adjustments, and don't forget that dose and take these extra medicines. And if you have ADHD, you might be bad at that.
Oh, yeah.
Right? And so there are many ways that we can imagine that it affects the quantity and quality of life. But even if that wasn't true, it's also, we would just want to treat it just to be nice to people. You know?
I like to live longer.
Yeah. Great. Well, thank you two so much for all that you do. It's just so amazing to meet people that just want to help and are so passionate about what they do. You know, we talked a lot about ADHD, a little bit about autism, you know, just to name a few other neurodiverse complications from, what is this, conceptual analysis from a study from the University of Connecticut that Pedro found. So neurodiversity is a term. It encompasses a wide range of neurological differences leading to distinct cognitive characteristics. And those are categorized by like ADHD, autism, dyslexia, dyscalculia, anxiety. So there's such a wide range of neurodiverse disorders. And I think that it's important just to mention that. And there's resources out there, and I'll have Pedro kind of talk about those.
Yeah, we do have some resources out there for the community. We mentioned one resource here is joining that subcommittee group. So if you want to join that and you're part of Mayo Clinic and an employee, that's open for you. Out there in the community, I know there's other resources. We got the Job Accommodation Network, Jan, which actually I learned from the subcommittee. Yep. If you're wanting to know, Chronicle Keepers, about accommodations, or if maybe you're in line for one, that's the website to go to. We'll post that on our links on our website. In addition to that, you also have the PossAbilities groups here in Rochester, which have a lot of activities that are free for the community. And I know there was an American Foundation for Suicide Prevention walk just recently that occurred on October 5th. I'm pretty sure they're doing more of that stuff, so we'll put that link there as well. And then also I got this awesome sunglasses here from the Reading Center Dyslexia Institute of Minnesota. I don't know if you guys ever heard of that. We had a Latino Fest in September, and they were there, and so it was really cool to connect with them. And if you guys just need some more information on that, definitely we'll have that information as well on the website. So we appreciate both of you guys being here, spending the time with us to converse over neurodiversity. And I believe our next episode will probably be about, what is it? Because I forgot.
Language services in medical care. So
Great.
We got each other's back.
yeah.
You know what? Everyone with ADHD needs a partner like that.
Yeah,
They do.
sure.
That person who just has their back. So thank you so much for having us.
Yeah.
Pleasure
Thank
to be here.
you.
Thank you.
Thank you. Oh, I also got you guys dice, so I think I gave you one. This one's for you.
Cool.
Pedro's giving out
you.
gifts.
Yeah.
All right.
That's my love language.
Chronicle Keepers, we'll see you next time. We'll talk about the use of interpreters and language services in medical care.
Have a good day.